You're listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. We're a podcast on Spreaker as well, so look us up. We're distributed on their platforms. Jeannie Roller is my co-host. Jeannie, you're in Indiana. I am here in South Florida. Today we are talking about the description, the stories that we keep hearing over and over and over again. Sadly, sexual abuse by medical industry personnel. What it means, why does it keep happening? I mean, you want to bring this topic up. We need to talk about it again. We did a podcast not too long ago about the 2,500 plus women sexually assaulted by the OBGYN doctor at Fort Hood and also Tripler Army Center in Hawaii. So I'm waiting to hear what that scenario is going to be, the outcome, because the interviewees that I watched on, I believe it was PBS, were saying that basically they didn't think anything was going to happen. It was going to get buried and, we'd never see the light of day. And I want to say that particular case, if I'm saying it correctly, wants to push their case to the Supreme Court, which I wholly agree with.
Well, Cindy, I wanted to go through some of these things and, whether it's a routine checkup or a more intimate procedure, you should feel safe and respected. I mean, it can be as, anything. If they make a sexual statement to you, that's sexual abuse. You shouldn't have to put up with that. I mean, these are supposed to be professional people, and they shouldn't be making any sexual comments to you. But let's go through privacy. You should always have privacy during exams and when changing your clothes. They shouldn't be in there watching you unless you ask for help. So you shouldn't be undressing and getting redressed with them in the room. They should leave. They should tell you exactly what needs to be done, why it needs to be done before any of the exam is started. And they should request permission to touch you and a clear reason why before they do it. And as a patient, you have the option to stop an exam at any time.
Right.
Now, the chaperone thing to me is very murky because, a lot of times they'll have their chaperone in there. And to me, that chaperone may not actually be there to protect you, but rather to protect the medical provider. So you should always have the option to have your own person in the room with you if you want. If
Always.
They say no to always, that's a red flag to me if they say no. And exams should be done with gloves. And that's what you find out a lot of times. These doctors who are molesting female patients, they're not using gloves.
Right.
That gloves should always be worn when they're doing an intimate exam. And, they should take your pain seriously, and they should respect your religion. If you have religious beliefs that say no to certain things, then they should respect that. Now, the other thing is what isn't okay. They need to use proper covering or draping during an exam. They should only have the area that needs to be examined uncovered. When done with that area, they need to recover and then, ask your permission, tell you what needs to be done, and then uncover the next area. You should never be left totally exposed or exposed unnecessarily. And they should encourage you to ask questions and explain each step as it's happening. They should never, as I said earlier, make sexual comments or gestures, touch you without gloves, refuse to explain what they're doing, insist that you fully undress when it's medically not necessary. And that's a big one, Cindy, because I think in that case that you were talking about, some of those women were being told they had to strip and have unnecessary exams.
Well, you ticked all the boxes of what they were talking about that did happen to them. Every one of them you've said that's what happened to those women, and worse.
Yeah.
And some of them did realize, just to interrupt you, that was happening, one specifically, because they had picked out 4 people to get different points of view. And the one said, if you do that, I'm leaving. And then I think that person wound up leaving. She was the one that was the most adamant, if you will, and forefront with what shouldn't be done. And the other ones were just like, I trusted and I couldn't believe that I was blindsided, which is what we say.
Yeah. Yeah, it just keeps happening, Cindy.
It does.
No,
It's horrible.
it is. Another thing is no medical professional should be asking you for a date or
Oh,
favors in exchange for treatment.
yeah. Covering their wedding ring when they're talking to you. Yeah, I know.
Yeah.
Yeah, let's
Yeah.
talk about all that. I had a dental procedure, and we're talking about medical stuff. I had a dental procedure last week, and I was applauding how good that office's care was. And I've gone to the dentist for a while, couple of years and whatever, just applauding. And I'm like, this is what needs to happen in the medical community, in the healthcare community, not just everybody's afraid to go to the dentist. I'm like, the dentists that I've been to have always been like that. I mean, and there's bad eggs in every profession. There is. We talk about that all the time. And there are phenomenal people in every profession, certainly in healthcare. And I applaud them. I don't know how they put up with the rest of it and why they have to be subjected to that. But kudos to a lot of these offices that are doing the right thing. I just wish that we could out the ones that aren't.
Yeah. Well, another thing, Cindy, and this I think plays into it a lot, is they should not be asking unnecessary questions about your sexual history.
Right.
So I think that happened in those cases too, that doctor was inquiring about their sexual histories.
And about they're single, if they're single, married, divorced, that kind of thing. I mean, some of the paperwork has that. I don't know why they have that, some of the questions on the paperwork, but I agree with that. I've had that happen to me in offices where the doctor will point blank look at you and ask.
Yeah. And of course, if you feel like you've been touched in a way that is inappropriate, then that's probably what happened.
Right.
Because, I mean, we know.
Yep.
And don't be afraid to report it.
Absolutely.
Now, having said that, I want to mention that medical sexual abuse assault is one of the most underreported crimes.
Yeah.
That only 5 to 10% of victims ever make a report. And I can tell you that from our experience, they just don't take it seriously, especially if it's a man being abused by a female provider.
Yeah.
So, and we've talked about before in all these big cases like Nassar, it went on for years and years and years and years.
Right.
The victim count is high.
Yep. And the women, us as women, we're getting more educated because of this stuff and learning different things that we should have known all along and didn't because we blindly trusted and found out. And it's so abhorring. It's ripe for PTSD or whatever when your mind and your ears hear that this never needed to happen and it had no place in the medical community. And that's happening more and more. And those 4 women that were on that interview, a lot of that stuff is what they said. A lot of it's what they said.
Right.
That we didn't know, we trusted, we thought this was part of the examination, and then the one said, I knew it wasn't, and on and on and on. You're exactly right. So, I mean, male or female being abused by males, females, it's horrible. Horrible.
As I said, it just never, ever ends. I mean, children, babies.
Yep.
It just blows my mind that we see so many of these cases.
Yeah, I'm hoping in the last 30 seconds that we have left here for the show, I'm hoping that more of this being reported, not that I want to hear anymore, I don't at all, that will finally come to some kind of, maybe this case going to the Supreme Court will do that, will force that issue, that this needs to be addressed. Because also on the other side to it is you don't want to be accusing innocent people. People that haven't done anything. So I get that. You don't want to be an innocent person in jail. That's why, innocent until proven guilty is our system. But you don't want all of this stuff. Look at the numbers. Look at the numbers that we're racking up, sadly. And it's around the globe, but certainly the ones you and I talk about, Jeannie, they're racking them up unbelievably. It's, the odds are just unreal on what are we getting good care and what are we not. On that note, stay listening to Evergreen Media Network.